Hi, my name is Dr. David Schmuckler, owner of Kennett Chiropractic Center and co-author of the book Outsmart Your Fork, A Mindful Guide to Permanent Weight Loss. In April of 2006, I suffered a severe stroke and was totally paralyzed on my right side and had great difficulty speaking. I also suffer from severe depression after my stroke. While I was in the hospital, my neurologist told me, even if you can't move your right arm and right leg, visualize that you can. By visualize, I was moving my right arm and leg. I was retraining and rewiring my brain. This rewiring of your brain has a fancy medical term called neuroplasticity. I use neuroplasticity to make a full emotional, mental, and physical recovery from my stroke. Your brain rewires your entire life. If you do new and novel things, it will make new, healthy connections. The more you practice these new activities, the healthier your brain becomes. Pain is defined as an emotional response to tissue damage or potential tissue damage. With acute pain, you have tissue injury with inflammation and swelling. An example of acute pain would be if you sprained your ankle yesterday. Advil and Aleve can be used to relieve your pain from the inflammation. If the pain is severe, a medical doctor may prescribe a narcotic pain medication such as Percocet or Vicodin. Narcotic pain medications work on your brain's opioid receptors and are addictive. These should only be prescribed for a short period of time if they are prescribed at all. Chronic pain is pain that lasts beyond the time it takes for the tissue to heal. It is a separate condition from acute pain and should be treated differently. Fibromyalgia is an example of a chronic, benign, painful condition. By benign, I mean non-cancerous. The United States has 5% of the world's chronic pain patients, but takes 80% of the narcotics. Why? Usually with chronic pain, there is little or no tissue damage, but you still experience pain. Your pain is most likely coming from your brain and has a strong relationship to stress, anxiety, and depression. Pain is a brain experience and tells the rest of your body where and how much you hurt. Your pain level also varies by what you're doing. For example, if you're really focused on your job, your pain may lessen or you may not feel it at all. Or if you're worried about your family or your job, your pain will increase. Is there a time and place to take narcotic pain medication? Yes. If people are suffering from a terminal problem like bone cancer, narcotic medications can afford them relief and great comfort. Taking narcotics for chronic benign conditions like back pain, shoulder pain, and fibromyalgia just does not make sense. You often create two problems. You have not solved their chronic pain, and people often lead to drug addiction. And this often leads people to drug addiction. Here's what we offer at Kennett Chiropractic Center. You get an explanation of your chronic painful condition in non-technical language that is easy to understand. You will know the difference between chronic and acute pain and how the treatment for each varies dramatically. Our treatment for your chronic pain will include chiropractic care, exercise, and stress reduction. If you have chronic pain, you can't keep thinking and doing the same things and expect your pain to magically disappear. Call 610-925-044 today or go to KennettChiropractic.com for more information. Thank you.